in keeping ourselves fit or being engaged in physical activities or watching the food that we eat, like the diet. Okay, so those are all behavioral changes and we don't normally need intervention. So for some people, they also might want to reduce or cut the number of times they drink alcohol. So, and they can do it without professional intervention. But of course, there are certain cases in which we need professional help to be able to successfully change our behavior. So, and it's human nature to be resistant to change. Most of us are creatures of habit. So it's not always easy for people. And ultimately, when we talked about treatment and recovery, this is a drastic change, not only in the life of our client, but also of their family. So change about their social interaction, maybe the way that they communicate, the way that they solve problems, the way that they deal with people, as well as the way that they work, medical concerns, and other pertinent issues. So, were you able to think, have any of you experienced any personal change that you have experienced in the last few weeks? So did any of you try to make a change? And can any of you share and answer these questions that you can see? Did anyone undergo a specific change in their life? Oh, I think we probably all have, right? Like staying in quarantine. So did your countries implement forced quarantine on people? So anyone wants to share? Or I can share my personal experience recently. So the change that I made recently is avoiding going to the malls, right? And if you know Manila, so if you know the Philippines, so just like any other Southeast Asian country, so we tend to go quite frequently and even hang out or meet friends in different places, usually the malls, because everything that you need are present. So you have restaurants, you have department stores, you also have supermarkets. Okay. So prior to the pandemic, I would say that I will be in the mall maybe three or four times a week. So I will have lunch there, meet some friends. So what I did so recently, like even for my buying, like when I go to the supermarket, in the family, I'm the one that actually do the grocery shopping for my family. So we do it before every weekly. So the change that we made is that to just purchase our grocery once every 3 weeks. Okay. So how did we decide to make the change? So first is accessibility and availability of transportation. So that was quite challenging. And then we realized I have, my mom is 60 years old and I have a niece who's 13. Okay, so we wanted to make sure that I limit my exposure, limit everyone's exposure to going out because of the virus. Okay, so those are the people that made us consider carefully consider our actions. So the events or the circumstances is the pandemic. Okay, so in a lot of ways, so you have to, and it's quite challenging. No, I shop for 7 people, and basically, when we do the supermarket, there's no more going to the wet market. So everything that we need for 3 weeks, we have to buy. So what steps did I take to make the change? So first, I make an arrangement, like I try to go to the supermarket on a Thursday. So because my schedule is pretty free on a Thursday. And aside from that, I also know that there are less people going to the grocery on weekdays. Okay? So I made the arrangement for the transportation. So I psych myself up in preparing. So making sure that I have like I follow the protocols. So that means alcohol, uh, face shield, face mask. But um, but my level of motivation did not stay the same because for Manila, okay, our situation has been there since March 15, and until now we're still in community quarantine. So that's 8 months, and I feel fatigued. And it's actually very difficult to shop for 3 weeks for 7 people because they only allow one person to enter the supermarket, and I have to push a very big cart, which includes like 25 kilos of rice, all of those things. So it's challenging, but it made me realize that well, it's possible, and then it also made me appreciate, like the options that we were given before, as well as the people that makes the sacrifice to be able to provide for our basic needs as well as our services. So, but right now, just like any other Filipino, I'm tired. Okay, I'm tired of not being allowed, or the limitations of being able to go out is exhausting. Okay, so when we talked about change, we talked about motivation. So motivation for change affects whether a person enters treatment, continues in treatment, and adheres to a specific change strategy. So when we talked about motivation, a study shows that it actually influences client retention as well as even client enrollment. So our challenge is to how do we keep our clients motivated to be able to implement the change that they want in their lives. So when we talked about motivation, this is not static. So motivation is a dynamic, purposeful, intentional, positive, and changeable behavior. Okay, so motivation changes over time. So, but it has to have a focal point. There must be a purpose behind the motivating factor, and it's also intentional because when we talk about being motivated, it's not just doing things based on the flow. So, by in essence, we have our goal, we have our objective, and that's what keeps us motivated is achieving that goal. So motivation also fluctuates over time and in relation to different situations. So our motivation changes from day to day, even hour to hour, as well as our motivation to different activities would be different. So it can go back and forth between conflicting goals. For example, so most of our clients, and this is commonly what we heard, that they want to stop their use of substance because they know that it was not good for them. Yet they have difficulty because if they stop using substances, then who will be their friends? Their social support are all drugging friends. So they want to belong, to be part of the group. So that's an example of a conflicting goal. So motivation also varies in intensity, slowing in response to doubts, and increasing as doubts are resolved. So motivation, as I mentioned earlier, changes. So the degree of motivation that we experience might be different from time to time. So let's say, for example, you might have clients that at the beginning are very much motivated to change, maybe because they were involved in an accident or they were in a legal battle. Some have resentments. Okay, they don't feel motivated. But as they continue along the treatment process, they are able to build their self-efficacy, they're able to understand, build their self-esteem, um, acquire communication skills, understand their disease, then their doubts are resolved because there's a mind shift, an understanding that behaviors are changeable and that they can do it. So it also varies greatly among potential behavior changes. So for example, for some people, it's actually easier to give up drugs than alcohol, because when we talked about substances, psychoactive substances like heroin, marijuana, cocaine, or methamphetamine, all of these are illicit substances. So for them, they at the back of their mind, they understand why they have to stop it. But they don't understand why they have to stop drinking alcohol when in fact it's a legal substance. So what are our internal influences in terms of motivation? Okay. So the internal influences on motivation, these are intrinsic. This is within the person. Emotional states. So give me an example of an emotional state that influence motivation. What do you think are certain examples of emotional states that make a person more motivated or less motivated? So anybody? So what are the examples of emotional states? And how do you think it can interfere or influence with motivation? Anyone? So fear. Do you think that fear can influence motivation? Yes, no, some ways.
Yeah, in some ways.
In some ways, okay?
Yeah.
So I can give you a specific example here in my country. Okay, so as you are aware of, so the current administration has an ongoing war against drugs. So they had a program known as plea and knock and plea. Actually, so they knock on your door and then people get arrested or listed as either suspected drug user. So there was a time at the beginning that there were a lot of casualties because of that program. So what happened was that people were very afraid. So because of their fear, what happened is that they enrolled themselves into community-based treatment program. So they were very motivated because they were afraid for their lives. Okay? So in any other ways, any emotion could either influence, okay, it could increase or even decrease our motivation. So some people would actually go into treatment as a response to guilt, okay, and extreme sadness. So let's say, for example, the parents died. So that's when they wanted to, that's when they feel that remorseful and they would like to seek treatment. But again, as I say, so our emotional state, as you know, is also not permanent. So, like motivation, so the feelings that we have, the affect that we have changes from time to time. But we do recognize that it is an internal influence on our level of motivation. Next is we have life goals. Okay, so what are your goals and your objective in life? So this actually influences our motivation. So in your case earlier, I think Ali, no? So Ali, because he has a family, and he wants to be able to keep his family, maintain it. So that's for him. Well, that's actually an external motivator, but his goal of being a responsible father and a loving husband is an example of an internal influences on motivation. We also talked about perception about risk and benefits of behaviors. So for example, like those people who are selling substances, okay? So they think about like, okay, this is the way. So if they're fencing stolen items to be able to sustain their drug use, so they think about, is it sufficient? Okay, so what I am doing is valuable enough, or is it worth it to go to jail because of my substance use? And as well as cognitive appraisals of the situation. So what the client thinks about the situation. So that's why when we talked about earlier with regards to the recovery capital, it's very important that your client is able to have a meaning and purpose in life. Because if he or she feels that her life is meaningless, it's not worth anything, then it's very difficult for her to get internally motivated. Okay, how about external influences on motivation? So we have family and friends. You want to change because of your family, diba? Or you want to change because of your friends. You also want to change because of situations and experiences, like situations that is like normal motivator in my country are legal experiences. Okay, if you have a pending case, okay, so you might want to reconsider your position and seek treatment instead of going to prison. So if you were involved in an accident, if you become homeless, so you might consider getting into treatment, okay, because that's your external motivator. So the community support, whether in presence or the absence of it, could also be an external influence on motivation. For some people, the absence of support becomes a driving force, a motivator to prove people wrong. But mostly with our clients, they have to feel that people are willing to support them and accept them despite the challenges that they face. So, being in a community that's supportive, with family and friends that understands the disease is also helpful. So now we'll talk about stages of change. So this is actually an introduction to stages of change, but I add several slides so that you'll be able to see exactly what are the characteristics of each change. Because later on, what I want to do is to ask you to be able to describe the different characteristics or appropriate interventions for a person in this particular stage of change. So the stage of change was proposed by Prochaska and Di Clemente in 1994. So they talked about a cycle in which a person who wants to change a behavior would stop from a pre-contemplation to a termination phase. So there's the stages of change are pre-contemplation, contemplation, preparation, action, maintenance, and termination. Recurrence, okay, can occur in any of the steps. So a person could go from preparation, contemplation to preparation, but they could also go from contemplation to recurrence. So these are the things that we have to consider. Okay? So how is it relevant to our clients? How is it relevant to the treatment process? So when we talked about pre-contemplation, so the characteristic of a person in the pre-contemplation stage is not seriously intending to take action in the foreseeable future, usually measured as the next 6 months. So in other words, A person in the pre-contemplation stage do not see his substance use as an issue, as a problem, as a cause for concern. So they couldn't care less because to them it's all fun. There's no problem. I'm okay. Okay, that's pre-contemplation. So the next stage is contemplation stage. In contemplation stage, a person, okay, the client perceived that there is cause for concerns and reasons to change. Okay, so and he or she is now considering making behavioral changes. So contemplation, the primary characteristics is ambivalence about change. So what's ambivalence? So it's like it's like a seesaw. The person is thinking of changing, not changing, changing, not changing. So in this case, so the person recognizes that there is an issue, there's a cause for concern, but at the same time, he or she is not yet very confident that he will be able to do the necessary changes. Okay, next is the preparation stage. Okay, so a person in the preparation stage has decided to change and intends to take action within a month or the very near future. Clients might be fully ready to change, but be unsure of the best way to go about it. So what do you think is the what do you think are the steps, or what do you think are the behavioral manifestation that a person is willing to is under the preparation stage? So what do you think is the client what are the behavioral manifestation that our client will be in the preparation stage? Anyone?
Sorry, could you repeat your question, Professor?
So what do you think are the behavioral manifestations that our clients are now in the preparation stage? So what do you think the client is doing?
I think he or she may find the treatment program that he or she is suitable.
Okay, that's correct. So the person if our client is already in the preparation stage, they are gathering information in terms of the treatment facility that they wanted to go into, what are the services that they need. Okay, so in this time, so in the contemplation stage, so the client still hasn't decided on what needs to be done. But in the preparation stage, the client knows that there is already a determination that he wants to change, but yet he is not very certain on how to go about it. So the next stage of change is action. So when we talked about action, so in this stage, the person is already in the behavior modification. He's already willing, he's already ready and willing to change the behavior to overcome his or her problems. So an individual in this stage have successfully altered the problematic behavior for a period of from 1 day to 6 months. So a person who's actively engaged, let's say for example, a person who attended his first 12-step meeting is already in the action stage. So a client might be doing all the right things, but still sometimes feels a strong desire to use substances. Okay, and then next is the maintenance stage. So the person in the maintenance stage has been engaged with new behavior. They work to prevent relapse and consolidate all the things that they have learned during the action stage. So let's say, for example, so normally if we treat patients, so we give them counseling to be able to work on their issues, but we also give them a new set of skills to be able to use. So what are the normal skills that we teach our clients during the treatment process? What are the skills that you provide your client during the treatment process? So any of you working in a treatment facility? So normally like in treatment setting, right? So we don't only provide counseling to our clients, but we also give them skills. We develop their skills such as communication, refusal skills, time management, even financial management. Okay. So in a lot of ways, in the maintenance stage, what they do is that basically to apply all of these steps that they have learned, all the skills that they have learned in terms of the treatment. So in their everyday life, so they apply it. So this stage extends from 6 months to an indeterminate period past the initial action. So next is that there's also a stabilizing behavior and avoiding relapse as the hallmark of maintenance. So do you guys remember again? Can you tell me what are the stages of change? So you can type it in our chat box or you can unmute yourselves. So do you recall what are the stages of change?
They are
Pre-contemplation,
sorry.
Okay.
pre-contemplation, contemplation,
Contemplation,
and preparation, action,
preparation,
maintenance,
action, and
maintenance,
maintenance.
and
Okay. So remember that because you will be able to actually discuss that again on your UTC form. Okay, so what I will do right now, so because I cannot
you
yeah, so since I cannot open another tab, so what I will send to our chat box the Google Jam board. So I will assign you again to breakout groups. So now we need 6 breakout groups to be able to put into your responses what are the characteristics as well as what do you think are the interventions that you could give to client who are oops, sorry, what happened? That's not what I wanted to paste. Hold on a second. I think this is the case, the last case. I will send you again to breakout groups. Okay. Guys, can you try opening this link with your laptop? so that it's already open before I break you out into groups. So what you would have to do, okay, so do you have a copy of the training manual? Do you guys have a copy of the manual? So you actually, well, don't need the manual much in the sense that what it does is actually describes to you, just like what I mentioned, what are some characteristics of people, of our clients in the different stages of change. So if you click the link, I will open it in. Okay, so let me just open that so you can click it so that it automatically directs you to our brainstorming board. And then the ideas that you could think. Okay, so click the link. So, and then I will assign you to the different. So what you see is a Jamboard. So let me check if you guys can. So I'll teach you how to use this. Share my. No, that's not what I wanted to share. But because I cannot share my multimedia. So have you click the link? Have you seen the Jamboard? So you would see that there are 6. Yes, so you guys are there. So I can see people joining. So there are 6 slides. So pre-contemplation. If you move to slide 2, that's contemplation. So you just click the arrow at the top, and then you could see preparation, action, maintenance, and recurrence. So what I want you to do is, like, you see that there are post-its there that says an idea. If you click, you guys can see this, no? So if I click on the edit slide, so what happens is that, so there's at the upper right corner, so you click it and the 3 dots will appear, and then you could edit that and write your responses. Okay, so instead of breaking you into small group, so let's do it as a big group discussion. Any one of you who wants to write a description or an appropriate intervention for a person in the pre-contemplation, contemplation, preparation, action, and maintenance and recurrent stage could just write your thoughts in the sticky notes. Okay? So are the instructions clear? So very good. So there's already a response, like feedback. Okay. So we have about 12 minutes to do this, and then I'll show you the results.
Professor,
Yes.
could you repeat the instruction for this activity?
Okay. So what you could put in the Jamboard are either the description or the characteristics of people in each stage of change. And in addition, you could also include what interventions should be given to the people with that stage of change. Okay, so what do you think, what are the interventions or the treatment approaches that we could give? So for example, there's already one that responded in your group. So let's say you mentioned that for give information or provide feedback. Okay. So you could move that, like you see that in the upper right there are rectangle, in the middle of the Jamboard there are squares, rectangle, not square, sorry, rectangle, and there's a less than and greater than sign. So you just click the one on the right to move to the next next slides. Okay. Yeah, see? So there are already responses to it. So thank you. So we still have 8 minutes to do it. So we still have 5 minutes. Okay, so you still have 3 minutes. I see a lot of responses here. So 2 more minutes. Okay, last 1 minute. Okay, so it's 3:05. Are you all looking at your Jamboard screen? So let's go and discuss this one by one. So you tell me if do you think that if you agree with the sentence of this. So a person, so pre-contemplation, so either a characteristic or intervention that could be given. Counseling. Can we give counseling to a person who's in the pre-contemplation stage? Yes or no?
I think in some cases it can, maybe to aware his or her problem, but usually we don't do counseling in that stage.
Yeah. Why don't we do counseling in that stage?
Because at the stage, a person may not aware his or her problem. So that
That's correct.
yes.
Okay, so the person in this stage is not yet aware of the problem. Okay. What happened with the Jamboard? Okay, there. Okay, and then so I'll read other characteristics. Feedback. So can we give feedback to the client? So feedback and I think giving information are two related things. And normally, that's what happens for a person who's up in pre-contemplation stage. Maybe you give them this you handouts or like information on the effects of substances, and not necessarily explain it, but just make it available for him to read at his or her own time. So here they say that the characteristics, negative impact on the patient life by his substance use. Okay. So, but in the person who's in the pre-contemplation stage, do not recognize the negative impact of substance use yet. Okay. So they did not consider change is correct. So they ignore the problem. That's also correct. They're doubtful that there is a problem. There's also correct. Okay. So I'll move now to the contemplation stage. So you can move all your Jamboard with you in slides 2 of 7. So in a contemplation stage, that's correct. A person is reflecting. Okay, there's a reflection. So he's considering the good things, considering the bad thing. So the person in contemplation stage is also still thinking about drugs, but they have a recognition that substance use is bad. That's correct. So they're also thinking about their drug problem. They're also ambivalent. Okay, so meaning that it's like a seesaw. Okay, so they don't know what to do yet. So they are trying to make a choice. That's correct. So what are the possible interventions here? It says that to motivate him to change, give him incentives, or I guess give him reasons like internal and external motivator, support the client in making decisions or moving to the next stage, which is preparation. Reassure the clients about the possibility of overcoming the problems is also correct. Okay, on the third module, so we talked about, we use motivational interviewing. Okay, we talked about, probably discuss the treatment plan. So in this case, the client is already, maybe treatment plan will have to go to the action stage. So in preparation though, maybe we can talk about treatment options. Okay, so whether it's gonna go to an outpatient drop-in center, is it gonna be an outpatient setting? Is it gonna be a residential short-term or residential long-term setting? So we also provide planning and support. That's correct. We discuss about ways to change where he can find help, okay, or the things that he needs, okay. So a person, so if they're looking for a job, might be, okay. So they are in preparation stage. They are gathering treatment information and deciding which treatment program is suitable. And going to treatment, yes, or enrolling into the treatment centers. Okay. Now I am on slide 4 of 8. So we have, yes, that's when we provide the client, we discuss and share with them their treatment plan. We also talk about getting advice from people in recovery. I guess stigma was discussed to you. So I'll just revise the ex-drug addict with, because we know that it's a chronic condition, no? So they could relapse. So we could say getting advice from people in recovery. Okay, joining the treatment program. So when we say joining the treatment program, so they are actually there working on their issues, attentively participating in their counseling sessions, doing the assigned tasks, like if they have workbook. So cutting the drugs off or reducing the dose. Okay, joining counseling sessions, that's correct. Not using drugs, that's also correct. So they invite or they participate in therapy. So that's what we do for as a support, that's correct. We motivate and support the client, that's correct. And quit drugs, quit using drugs. So it's also correct. So I think like among the Jamboards, like all of the contents that you put in the action stage are all accurate. Okay. How about maintenance stage? So we talk about maintenance stage as avoiding risk situation. That's correct. Staying away from drug using peers. That's correct. Avoiding drug trading places. That's also correct. Not going to nightclubs or bars. Yes. Doing other activities than some other activities than drugs. That's also correct. Support and sorry, what's FU?
Follow up. I think.
And follow up. Okay, thank you. Support and follow up. That's correct. Okay, so a person in the maintenance stage is living a drug-free life. That's correct. So follow-up plan, avoiding triggering events, responsibility to the treatment program, stop using drugs for more than 3 months. Okay, so 6 months up is the maintenance stage. So I'll just put this as 6 months and above. Okay, so there. So in the maintenance stage, these are also all correct. Are there questions? Okay, and then last we go to the recurrent stage. So as we mentioned earlier, in the recurrent stage, a person could actually move from different stages. But these are the characteristics. Yes, they may feel shame. They may feel low self-esteem, okay, because they're frustrated. Okay, it goes back to the using the substances again, getting back to old habits, taking drug one time, that's also correct. A lapse, okay, could be considered, okay, a lapse might lead to relapse. Okay, so there are concerns with regards to self-confidence. Okay, they might state with old friend to use drugs. So those are all correct. And then as support, we provide them counseling, yes. We provide them with opportunity to be able to work on their necessary skills, build their self-confidence, give advice to come to treatment, okay, when relapse occurs. So, and it's very important that we have to discuss this in our client. So to me, for my personal experience, one of the most powerful um, one of the most powerful psychoeducation that we could give to our clients is in fact the understanding on the physiology of substance use disorder, the physiology and pharmacology of drugs. They have to understand that there might be instances, although we expect them and we sincerely hope that they do not relapse, but the nature of the disorder makes it possible. Right? We define substance use disorder as a chronic relapsing brain disease. So therefore, we know that in the event that there are triggers, cravings, and that could lead to lapse or relapse, that they will be welcome back in the treatment center, or there are people that they can go to discuss the issues and concern. So the shame that they are feeling, we should address that so that the lapse would not actually lead to a full-blown relapse. Okay, so are there questions with regards to Module 4? Are there questions with regards to the stages of change? Questions or comment or any other topic that you want to add? So if there's none, okay, I will proceed to Module 5, but just in case that there are some questions,